In this edition of Ask the Doc, I got a great question from Mel on Instagram that has been dealing with a shoulder injury for quite some time and hasn't got any relief or answers. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. All right, back at it for Ask the Doc. Just a quick reminder, if you want me to answer one of these questions, you can send that in to me directly. All the information to do this is wherever you're consuming that. Just send us over a message. And if we think it's a good question, we'll be sure to put it in the queue and get it on with the show. But the question was from Mel, said, I'm going on my 9th month of dealing with a shoulder injury that has been diagnosed as shoulder bursitis. I originally started feeling it during my yoga practice when I held a down dog position for too long. My primary care doctor started me off with 2 rounds of anti-inflammatories that helped for a bit, but as soon as I started using it again, all the pain came back worse. I was referred to an orthopedic doctor who did an ultrasound and an x-ray and diagnosed me with shoulder bursitis. They sent me out for 6 weeks of physical therapy, which only made it hurt more. A few weeks ago, I got a cortisone shot, and the pain is definitely improved, but not fully better. I'm afraid to get back into yoga, and the orthopedic doctor wants me to do more physical therapy. I'm concerned that something worse is going on with the shoulder and that it must be more complicated than just bursitis. Any insights into what is going on would be greatly appreciated. Thanks for sending that question in, Mel. Let's just start with a definition of what shoulder bursitis is from the folks over at the Cleveland Clinic. They define it as shoulder bursitis is the most common type of bursitis. It occurs when excess fluid builds up in a bursa, the cushioning pad between the bones and tissues and joints. Many people with shoulder bursitis also have shoulder tendonitis. The conditions cause pain and can affect arm mobility. Rest, shoulder braces, and steroid injections can help. Let's just begin. Anytime you have a itis in the diagnosis, tendonitis, bursitis, it's really just a code word for the doctor really has no clue as to what's going on or causing the issue. One thing we have to start to understand is why injuries occurred in the first place. It wasn't just the yoga pose that did this. It was a series of events that led up to it. So when you think of an injury in the most normal place, on one side, it's like a teeter-totter. On one side, you have what's called load, and on one side, you have what's called capacity. Load is what you do. Capacity is what you can take. Over time, when load exceeds capacity, that's when an injury happens. Now, a lot of times when you have these injuries without like real direct trauma that just built up over time, repetitive use, that load is just slightly more than capacity, but eventually it's like the straw that broke the camel's back, and the yoga pose is what kind of sent it over the edge. Now, a lot of problems in the current medical model is treating the effect instead of treating the cause. Bursitis in this situation is the effect of something going on. It's not the actual cause. But that didn't stop the doctors in this situation from going after the effect first, and no wonder it's not improving and getting worse. The problem with just getting rid of inflammation is that we need to start first with knowing why it's there in the first place and get to the root cause of it all. If we just take away the inflammation, but we don't address the underlying cause, it can expose the injury more, which is exactly what happened in this situation. And here's the thing. Any treatment that only improves like the symptoms and pain, but not the function, is actually very dangerous. Next thing was the ultrasounds and x-rays. These don't tell us much of anything. They might rule out some possible bone issues, but they don't tell us anything about the joint, the cartilage, the muscles, and everything else around there. And it's really impossible to make an accurate diagnosis from that alone. But usually it's like the go-to thing for doctors because it's cheaper and the insurance companies want to do whatever they can to not spend too much money, even though they got no problem collecting your premium payments each month. Now, physical therapy made it worse. Of course it made it worse because what's happening here is the tissue isn't healthy in the first place. Think of this problem as like a cavity in a tooth that needs like precise and focused drilling and treatment. Physical therapy, stretching, rolling, exercises, all that stuff is like brushing and flossing. That's very important, but it will never fix a cavity and only makes it worse. This is why physical therapy made it worse, because that tissue is damaged. Now, cortisone shots. I am a firm believer that cortisone shots are one of the worst things out there in the market. They're extra dangerous. Here's what they do. They do take the pain away, but they don't fix anything. Now, there's no pain signals to know, hey, stop and not load it. And even worse is it causes more damage in the long term to the bone and cartilage. And in all honesty, I would stay away from these at all costs. So what's really going on here with the injury? What I'm thinking here is it most likely started with scar tissue in the muscles of the rotator cuff. The rotator cuff provides movement and stability to the shoulder. Over time, with overuse, where I said that load exceeds the capacity, it doesn't get enough blood flow, it doesn't get enough oxygen. Over time, the body starts to lay down this stuff called scar tissue, which is made up of immature collagen fibers. When this happens, the muscle becomes less flexible and it becomes weaker. Now, the muscles can't generate as much force and they put more pressure on the tendons, the cartilage, and the joint. Then what happens is the body starts the inflammation process to protect and try to heal the area. So like I said before, the bursitis and the swelling is the effect, but it's not the cause. So how would I address this in my own clinic? First off, we would start with a thorough and detailed functional evaluation of the shoulder, and I'd also look at the thoracic spine as well to know exactly where the most scar tissue is and what's causing that restricted motion. After that, we would go into a hands-on treatment to effectively break the scar tissue down in those muscles. And throughout the process, we do an anti-inflammation approach as well to slow down that process through some supplementation, some diet modifications, and even some lifestyle things to really help get that inflammation in control, because you don't just have it in the shoulder. A lot of times people have systemic inflammation going on there that's causing a lot of problems. Once we get that full range back and the inflammation at bay, then we can start to strengthen the muscles back up to help those muscles get stronger again, because scar tissue, like I said, it causes two problems: decreased flexibility and weakness. But we got to get the flexibility and function back before we ever start to do the exercises. That's why physical therapy is wrong in the process, because it's trying to fix a problem before the actual problem was addressed. I would say this analogy, and it really helps, and I share this with my own patients and clients, is think of this injury, the shoulder joint itself, as like your thumb and it's stuck inside a car door. The car door is all that bad tissue, and we must remove that bad tissue, which is that scar tissue, to even give that thumb a chance to heal up. The problem that they're running into with this, all of those other, and I say treatments, I put it in quotes because they're not actually treatments. They're just trying to get rid of the symptoms. They're not addressing the door itself. They're really just lowering your pain level so you don't notice your thumb stuck in the door, but over time, it's gonna get a lot worse. So thank you so much, Mel, for sending that question in. And like I said before, if you have any questions you want us to cover for Ask the Doc, please reach out. But lastly, if you find yourself in the same situation as Mel and you're tired of getting the runaround from doctors who have no clue of what's going on, and you want to get on the path to getting your problem fully addressed and on the path to long-lasting pain relief, then reach out directly to us and request an injury consultation with me to get some real answers. All of the information to do that is available wherever you might be consuming this video. I appreciate you guys watching, and I'll see you on the next one.